we're going to talk about nasal cranial adjustments. Many people came in and said, hey, I hear you work on the sinuses and you allow people to breathe better and it helps their sinus congestion and maybe their headaches. And what is this? And so today we're going to demonstrate it and talk a little bit more about it. The technique is called nasal cranial release technique. It uses a kind of modified blood pressure bulb on a toggle switch with a balloon that actually gets inflated inside of the nasal cavity to relieve pressure that built up in that area, causing a variety of those symptoms. If Nicole zooms over here to this anatomy chart, you can see a side cutout of the face. This is the opening of the nose, and inside the nose you've got different openings, sinus openings, and there's typically 3 of those on each side of the nose, and they tap in on this little sphenoid sinus at the very back of the nose. That sinus is oftentimes congested. It will clog up the ability of the head and brain to relieve some of the pressure that's on it when that gets inflamed, and it will restrict some of the opening from the nasal area going down the throat. So people who have allergies are often congested. There's little turbinates inside of those nasal pores that will collect dust and debris and just never really clean out. And so by putting a balloon into these pores here and opening up these concha, it allows that person to breathe better, much more oxygen content to the body, taking pressure off the sphenoid sinus and relieving pressure from headaches, concussion pressure, a variety of issues that they may have with their neck and facial structure. So to do this, we've got Justine here, our volunteer, and we're going to do this procedure. I put a balloon on the end of this nasal cannula device, and I lubricated it, and we're going to put that at each of the 3 sinuses. We're going to start on the bottom sinus, bottom right, bottom left, middle right, middle left, top right, top left. When you have this done, there's pressure there. It's like getting water shot up into your nose. So it isn't necessarily the most comfortable thing, but this doesn't take very long. And the relief that a person experiences afterwards is hard to describe. People they sit up and they just talk about how they've never breathed this good in their life. And the amount of pressure off of their head is tremendous. So of all the techniques that I do, this is a fabulous technique, and you will notice a difference the very first time that we do this. So I'm going to start here, and what we're going to do is I'm going to tip her head back just slightly, and we are going to start on the bottom right side, and I'm just going to slowly insert this into the bottom right side. There I am in. And then Justine, what I'm going to tell you to do is as I blow this up, I want you to close your mouth and kind of suck in through your nose. That'll pull the balloon into it more. There we go. You felt that right away, didn't you?
Yeah.
And her eyes will water. It's just a reaction to the pressure that is going in there. Now we're going to do the bottom left side. The hardest part is kind of getting them in the right channel. But the more I do, the better it is. There, suck in. Good, just like that. Great. Now we're going to go to the middle part. And you feel that go all the way back into your throat, I bet, too, right? You start feeling drainage. Suck in. Good, that one was much easier.
It already feels so much better.
And you feel a lot of stuff drain down your throat, for sure. And here is this side. Good. Perfect. And now we're almost done already. Now we're going to do the top. The top one is a little bit larger, a little easier to get into. So if someone has had a car crash, they've smashed their nose up. Like that. They, all kinds of things. Maybe they've had past surgery and they've had the rotor-rooter job into their sinuses, but they still have problems. You can still do this procedure. Good, just like that. Take this off. And that's it. It's not too bad. You actually were a trooper. No, you're not screaming. I've had, sometimes there's a lot of pressure there. You do not want to do this procedure with an active infection. That would be very uncomfortable because those sinus pores are swollen shut and it's not comfortable at all. And so you want to wait till you're feeling somewhat good before you have this done. But like you can attest, you breathe so much different,
That feels
don't you?
awesome.
It's hard to explain until you have the procedure. It doesn't take any longer than we just showed. And it's just something that typically a person will have done not every day, once a week, up to 4 weeks. Then usually I might go out a whole month, then maybe 3 months, then maybe 6 months. And oddly enough, most of the patients will know when they feel restricted again. They'll come in and they'll say, I just can't breathe again. I feel it kind of slowly close shut. And so can you do that nose thing adjustment that you do? And we do, and it relieves the pressure and they feel great. So if you're ever interested in doing this technique, now you've seen it done. There are many YouTube videos out there that show this as well from other docs, and it's a fantastic technique. So I hope that helps.